I really like when, like in my personal sales as well, like if I can give a consumer a plan where they go someplace where they're going on an ordinary basis, and they run that debit card for the OTC benefit, and they see things like ping, 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 like coming off the bill. It's like when you go to the grocery store and you scan your Advantage card and you just see the money coming off. I think that's really impactful, and it makes them feel the value of that benefit.
And it's convenient too, like just to be able to just, go into the store, swipe your debit card, and, get the items that you need that you're able to get with that benefit.
Good morning, insurance agents of the senior market. Welcome back to another episode of Near and Far. It is May 3rd, a bright and early Monday, ready to go here, joined by Shalicia Hughes. Good morning, Shalicia. How are you?
Good morning, Bill. I'm doing good.
So, have you ever heard the phrase "Virginia is for lovers"?
Actually, I haven't heard that phrase.
Oh,
is it?
It's in all their commercials, and I was just wondering, would you love to talk about Virginia as much as I would love to talk about Virginia this morning?
Let's do it.
All right, awesome. So I wanted to see if we could talk about Roanoke this morning, and a lot of that came from the fact that you and Kristen and the rest of Team South, you're planning a partnership event there on June 4th, and we're not going to spend a lot of time on that, but that kind of started the conversation. Hey, if you end up listening today and you decide you want to join in and register for that partnership event, the registration link will be in the description down below, down there. But we started talking about Roanoke, and I thought, hey, let's do a Near and Far episode and just kind of talk about product. Because it is one of the biggest MA markets in the state.
Yes, absolutely. A lot of options available in Roanoke.
Yeah, and it's really one of my favorite towns. Like in terms of looking at the pictures up on the board, there's the famous Hotel Roanoke, which is really a sick place. Like it's a great time. You got to get down there and visit. It's a wonderful place to visit it for pleasure or doing meetings there. I really love it. But it's a great MA market. A lot of good product going on down there. What do you see that's really moving right there? What's really hot in Roanoke right now in 2021?
As far as the market, as far as carriers, UnitedHealthcare, really big player down there in that market. Anthem, as well as Humana, some top contenders in that market. Yeah, well,
and those are really three of the big dogs in the business.
Yes.
From a national carrier perspective, those are three of the big four for sure. But what's always interesting, I think, as a first step for me, whenever I'm looking at a market, is I want to understand, is this a market that's network neutral, or is this one where you really got to pay attention to this carrier has these two hospitals, this carrier has these two hospitals, and you got to kind of figure that out. Is this a network neutral market, or is that something to really be concerned with carrier to carrier?
The Roanoke market is a network neutral market, so that's a good thing there. You have your top hospitals like Carilion, Roanoke Memorial, as well as
Lewis Gale. Yep.
Medical Center. So those hospitals are in network for the major carriers that we just listed here.
Yeah, I would tell you that at various points in time when we've been operating in Roanoke, that was always one of the first questions. Do you have Carilion? And the others, the others were certainly players, but that seemingly was the first question we would get from a Medicare Advantage agent is, hey, if you don't have Carilion, I'm not interested.
Yeah,
just keep on walking.
Hospital.
Yeah, for sure. Well, hey, let's start talking about UnitedHealthcare. So I'm interested in your take on their products and what's happening for 2021, just because, like specific with conventional MAPD, they've got those two options, the $0 point of service plan and the $26 point of service plan. Which of those two is really shining, or are they both shining?
They're both shining, so they have a little something for everyone with those plans. So you have the Plan 1, which is the zero premium plan that we were just saying about. $500 dental, you'll get some over-the-counter $80 per quarter on that. And then, of course, the UnitedHealthcare plans are going to have that national network and that Renew Active membership, as well as the Plan 2. So that's the $26 premium plan. You're going to get a little bit more dental coverage on that plan. So if you're looking for, more dental coverage, that's going to give you about $1,500 on that plan. A little bit more over-the-counter coverage with $100 per quarter as well. So just depending if you're wanting to have zero premium or a little bit of premium with a little extra dental, you can find out of one of those two plans would be a good option.
Yeah, and I think I agree with you on that. That when I've talked to agents in Roanoke and kind of looked at the plan benefits, the whole $0 or the $26 plan to me, like, I mean, you had minor differences on some of the copays, like here or there, like maybe $5 difference on different things, but to me, it really came down to the dental benefit. I'd agree with you that it's $500 on of dental on the 0 premium. It's $1,500 on the 26. So if you think you've got significant dental needs where you're really going to need that to kick in, the $26 plan for that person makes a ton of sense.
Exactly.
Yeah. So and there, from a DSNP perspective too, I guess what's interesting is they've got the HMO plan, they got the PPO plan. Is it really the HMO plan that's the play?
Yeah.
Okay.
Yeah. UnitedHealthcare HMO dual complete plan in the Roanoke area is a really big one that is selling out there. That plan, rich benefits, $3,000 dental, $3,600 for hearing aid benefits. They have that healthy food, $55 that you'll get per month. $500 per quarter over the counter OTC benefits. So that's just and it's a debit card as well, so convenient.
And I've been put to shame on that particular benefit. It was a previous issue of episode of Near and Far where we were talking about OTC, and I was saying like, how can you possibly spend all of this over the counter? But like, how do you do it? And I got some great responses like, no, I mean you can really spend on this and this and this, because I'm just like, okay, are we talking about like diabetic socks and like, ibuprofen and like different things? So like, no, there's a whole lot more there.
Yeah, there's a lot in that OTC catalog, and this is a very benefit-rich plan, and you can stock up really with that.
And to me, Shalicia, this is just my personal preference. I'm interested in your take. I always tend to find that if I'm like trying to recommend plans to people, I really like the debit card OTC benefit. I mean, it's not a deal breaker. It's not like, oh, well, if you don't have a debit card, it's not worth anything. But I really like when, like in my personal sales as well, like if I can give a consumer a plan where they go someplace where they're going on an ordinary basis, and they run that debit card for the OTC benefit, and they see things like ping, 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 like coming off the bill. It's like when you go to the grocery store and you scan your Advantage card and you just see the money coming off. I think that's really impactful, and it makes them feel the value of that benefit.
And it's convenient too, like just to be able to just, go into the store, swipe your debit card, and, get the items that you need that you're able to get with that benefit.
Yeah, no, I agree for sure. And UnitedHealthcare, just in terms of their clinical care model, clear leader in the DSNP space. Like they do a fantastic job with it. Yeah.
Yes.
So staying on the DSNP subject for a second, let's transition to Anthem. Anthem certainly has really grown their share in the Virginia market over the course of the last number of years.
Yes.
But I think agents who may be new to working with Anthem may be confused, and I want you to shed some light on this. They've got 3 DSNP products in Virginia, and I would be hard pressed to try to explain which is great. So if you were to really kind of say, hey, it's option A is for this person, option B is for this person, how would you explain that to a new agent?
Okay, so for the Anthem plans, so you have the Anthem, the MediBlue full dual. So that's for the individuals that have full Medicare, full Medicaid benefits, and that plan is actually benefit rich as well, along with comparable to the UnitedHealthcare plan. So you're going to see $2,500 dental on there, $3,000 for hearing aids, $425 per quarter over-the-counter benefits, as well as those essential extra benefits that they have. Anthem really has, it's special with that plan, because those essential extra benefits, you won't see some of these on other plans, like things like pest control, service dog support. So you get really unique benefits with that. MediBlue, a full dual plan.
Yeah, and viewers of the show know, like those of you that watch Near and Far, Anthem Essential Extras. Like I love it. Like I say it all the time. Most innovative benefit I've seen by anybody, and I love that. And being able to toss that onto a dual product and giving those folks freedom of choice.
Yes.
Is a real differentiator.
Yes. That's a unique, very unique
Yeah.
with the Anthem plan. And then you also have the other two options for those individuals that are QMB. So they may not they have the full Medicare benefits, of course, but not the full, Medicaid benefits.
Yep.
So there's options available for those individuals as well. So Anthem has a HMO plan and a PPO dual plan
For the
that's
QMBs.
available for the QMB. So just some extra options available. We'll get a little bit more into the breakdown and benefits of those plans when we do our partnership event.
Okay, and that partnership event, correct me if I'm wrong, is June 4th?
Yes, June 4th.
Okay, so if you would like more detail on the UnitedHealthcare plans, the Anthem plans, and the rest of the products we're going to talk about next, don't just kind of get the little bit of detail that we're going to give you here today on Near and Far. Trying to do a quick overview for everybody so you get a feel for the market. June 4th, attend our Roanoke partnership event. Registration link in the description. So let's hit on Humana, because Humana, when I looked at their Gold Plus product, like last year when they were rolling out benefits for 2021, I was like, whoa. This seems like a real killer. What's happening with that Gold Plus product here in Roanoke?
Well, Humana, just in general, with any of their gold plans, it just seems like they are just always at the top of the market, just in any, because I work in the, South team, of course, South markets, and Humana Gold.
And your agents are writing a lot of
down.
Humana.
Yeah, all up and down this other market. So just anytime I see that gold, I'm like, I know Humana is coming to, have those benefit-rich plans. So you're going to see things like silver sneakers on that plan. Their OTC benefit is actually per month, so you get $15 per month on their OTC plan, and it actually carries over.
Okay, well that was going to be my question. Like, 15 a month without carrying over, that seems kind of rough. But 15 a month with the carryover, that's a good benefit.
Yeah, you get to use it all the way through until the end of the year. You're going to get national network reciprocity on the Humana Gold plan, as well as that's a zero premium plan option that's available. $1,000 dental on that plan. So a lot of rich benefits on the Humana Gold Plus plan as well.
Yeah. Humana with the Gold Plus, to your point, in a lot of the states where your team is active, they really came to play this year.
Yes.
For 2021, and I'll be interested to see how that plays out for 2022. But on that Gold Plus plan, I think one of the things that really sticks out to me is they've got $1,000 dental on the zero premium, and that really seems to be pushing that plan.
Yes, you're always looking for those extra benefits. So dental is a top benefit that the seniors are looking for. So definitely want to have that in any of the plans that you're putting together. On the Medicare Advantage arena.
Yeah, and I'd agree with you that the adding comprehensive dental to the lower price point products really seemed to be a key for 2021. Like that was something that we really saw as a focus from not just Humana in Roanoke, but all sorts of carriers all over the place. Was we are investing in dental because clearly they were seeing seniors are making decisions on dental.
Yes. Every plan, you gotta have that dental.
and those that don't are certainly feeling it. So for every consumer who's interested in MA, there's another consumer that's interested in Medicare Supplement, and that's something that we see. Some markets higher MA than others, some markets higher Med Sup than others, but Roanoke seems to be a pretty good balanced market in terms of Med Sup. What's really hot Medicare Supplement wise in Roanoke? What are our agents writing?
So for the Medicare Supplement market in Roanoke, we're definitely going to see some Aetna with their Ascendo product. We're going to see some Lumico. We're going to see some Mutual of Omaha. All of these Plan G carriers, they're all within a few dollars of each other, both male and female rates.
Yep.
So you're going to see that there. I would say the most standout would be that Ascendo product with CVS Health, because that household discount is 14%. It's really big. It's
a big number.
Really big discount.
Anytime we're talking about the Ascendo product from CVS Health, that's what we have to keep saying to agents is, okay, if you've got a single who doesn't have anybody living with them, the rate may or may not be okay. If you've got someone who complies with the household discount rules, which vary state to state, in some areas it's spousal, some areas it's spousal policyholder, others it's like the roommate rule, but you have someone who qualifies for household discount, that product like racing to the top.
Yes. When I was putting it in, jumped right up as soon as I put the discount on there, that Ascendo product. So definitely want to have that in your portfolio, but also want to have the Lumico, the Mutual of Omaha, and of course the Anthem plan as well.
Yeah. One thing that I thought was interesting when we were prepping to have this discussion today, and I was taking a look at CSG actuarial and what it looked like. Not just at 65 female, but at 71 on G. Spent a lot of time looking at G because that's really what's selling a ton right now. Is that at both of those age bands without the household discount, like you had 3 or 4 products that that we were talking about that were all within like $1.50. Yeah. We ran the household discount rates. 3 or 4 products all within $1.50, which really puts the agent, I think, in a perspective to say, hey, who do I want to do business with? It's not like some areas where it's like, well, heck, I got to do business with this company because they're $6 lower than anybody else.
Right.
It really becomes about ease of doing business.
Exactly. You get your pick in the Roanoke market, and I guess if you want to break it down to commissions, definitely take a look at which carrier. Those bonus programs, I know Lumico is coming out swinging with bonus programs for Q2, so definitely take a look at some different options in the Roanoke market for the Medicare supplements.
Yeah, I mean, I'm just being straight up. Like, if I was in Roanoke and it's like, okay, I've got 4 products that are all within $1.50 a month, I'd be like, who's gonna pay me?
Right.
I mean, like, I'm not working for free, and you got a premium difference that's that minimal. I'd say, okay, I want to know who's gonna help pay me for my services, my expertise, and if it's like I could make 22% and cash for apps, or I'm making significantly less than that, I'm not doing a disservice by the client. Like, I want to understand, who's going to fill the pocket.
Exactly.
It's a show me the money situation, I guess. I guess if we're playing off Jerry Maguire, it's that type of thing.
Yeah.
Yeah. So, well, Shalicia, really excited that you could join us today. Agents that would like to hear more from Shalicia and her all-star team in terms of our Team South group that works in the Roanoke market, attend our Roanoke partnership event on June 4th. Again, description is going to hold that registration link for you. We will be back with you on Wednesday, May 5th at 7 a.m. This has been Shalicia. I'm Bill, and this has been Near and Far. Have a great rest of your day.